33,000 people are estimated to have COVID-19 in England. The latest track, trace and isolate figures show that just over 10,000 people with COVID-19 were reached and asked to provide contact details. I do recognise the hard work that's gone into this, but if 2/3 of those with COVID-19 are not being reached and asked to provide contact details, there's a big problem, isn't there?
On the contrary, Mr. Speaker, I think that the right honourable gentleman has been stunned by the success of the test and trace operation, and contrary to his prognostications of gloom, it has got up and running, I think, much faster than the doubters expected. And they are getting it done. Dido Harding and her team have recruited 25,000 people, and so far they have identified and contacted 87,000 people who have voluntarily agreed to self-isolate to stop the disease from spreading. Now, I don't think he would have predicted that a few weeks ago.
I wasn't asking about those that have gone into the system, the 10,000, or who's been contacted. I was asking about the 2/3 of those with COVID-19 of the 33,000 who weren't reached. This is a big gap, and the Prime Minister risks making the mistakes he made at the beginning of the pandemic, brushing aside challenge, dashing forward, not estimating properly the risks. If 2/3 of those with COVID-19 are not being contacted, that is a big problem.
The 33,000 cases in the country is, of course, an estimate. What NHS Test and Trace is doing is contacting the vast majority of those who test positive and their own contacts and getting them to self-isolate. And it is a formidable achievement, Mr. Speaker. And yesterday, the right honourable gentleman was kind enough actually to say that he supported our policy and supported our programme. I seem to remember him saying that loud and clear yesterday. Today, and as I say, I understand the constraints of the profession in which he used to work. I know how it works. Yesterday and today, he seems to be yo-yoing back into a position of opposition. Which is it? Is he supporting what we're doing, or is he against it?
Up until last week, the government maintained that the app was critical, another of their slides. But at the weekend, the Health Secretary downplayed the app, saying it was only ever additional support. So which is it? Critical or not?
Mr. Speaker, I wonder whether the right honourable gentleman can name a single country in the world that has a functional contact tracing app, because there isn't one. What we have, and I think what has, I'm afraid, left the opposition slightly floundering, is a very successful test and trace, NHS test and trace operation, which yesterday they supported. Yesterday they said it was good enough for this country to go forward with step 3 of our plan. Today they're yo-yoing back again and saying that it's not good enough. I think they need to make up their mind. I think they need to get behind NHS test and trace and support it and take the country forward together.
Germany, app working 15th June, 12 million downloads. 12 million downloads. Mr. Speaker, I checked that overnight. 12 million is way beyond. The Health Secretary said we'd have the app by mid-May, presumably on advice. The Prime Minister said we'd have it by the 1st of June. Now the government ministers say it won't be ready until the winter. We've spent 12 million on this. Other countries are ahead of us. When are we going to have a working app?
Mr. Speaker, I'm afraid he's completely wrong, because no country in the world has a working contact tracing app, and we've always been clear that the app would be the icing on the cake. If we can get it to work, it would be a fine thing, but there isn't one anywhere in the world so far. What we do have is a fantastic test and trace, NHS test and trace operation that is already up and running, that is going to get better and better, and will be indispensable to our future success.